Hello, dear colleagues, and today we will continue our course on intelligent systems and technologies. And today we'll talk about ethics. We will start to describe some uh, agenda for today meeting, and it will be understanding of AI application in healthcare delivery and what are the ethical issues here, and what are the ethical foundations of healthcare and AI in general. And we will talk about AI and incentives in healthcare delivery and payment structures. So we will try to combine these three topics. And the modern healthcare system consists of many interacting parts. And at each stage of interaction, each of the parts generates, collects, and analyzes vast amounts of data. Data is generated by healthcare providers in interaction with the patient. Intermediaries such as insurance companies and government funds that provide state-level insurance programs. Data streams are consistently circulating in the healthcare system right now. And it is the data and that makes it possible to build and apply intelligent systems in healthcare. So possible areas of application of intelligent systems or systems with artificial intelligence technologies will be disease prevention, early detection of diseases, improve diagnostics accuracy, robust surgeries, follow-ups of patients and medical staff, choose of treatment tactics, including personalization of treatment, pharmacotherapy, selection and substitution of medications, quality control of medical care, health management, and patient navigation. So also it will be applied in management procedures according to the general institutions in this industry, and of course it will be related to medical education. The application of artificial intelligence raises ethical issues that need to be addressed by its developers and users. As well, there will be important stakeholder in this area, such as patients in general. And what are these ethical problems here? In general, we should ask the following questions. Do AI tools help or harm patients, their families, and caregivers or healthcare providers? Are these tools socially fair? Where do ethical problems come from? They can arise due to various aspects of AI. Nature of data which is used in the systems, methods of data collection, and a way to develop artificial intelligence models. How they will result and how they will be interpreted by doctors and used after that. So AI will raise serious ethical concerns about the privacy and security of digital data. Especially in the field of healthcare, these issues are very important, as medical data is highly confidential and protected in almost all countries. The use of machine learning technologies can lead to errors, cancellations, and these concerns could be biased by these models and by data on which they were trained, and these models will not be able to represent all the population because they were trained on a certain part of this population, because of course we are unable to use all the data for training. And there could be other characteristics which we can analyze. So there is a citation, even after observing the frequent or consistent conjunction of objects, we have no reason to draw any conclusions about any objects other than those with which we have had experience. And this is a very important idea, and actually this is a quite old citation, and this is relevant and nowadays. So all the systems we're creating now will somehow be in the controversy with this idea. According to this concept, all classifiers have the same error rate when arranged over all possible distributions of data. Therefore, the classifier must have a certain bias about certain distributions in order to model them better. As well as the work of Dutch lawyer and philosopher who works at the intersection of law and technology, was written especially about the issue of bias and fairness in machine learning algorithms. In this article, and on agnostic and bias-free machine learning, privacy as a protection of the incalculable self was mentioned. And she argues that there is no such thing as bias-free machine learning, and in order for the algorithm to model data and make relevant predictions, bias needs to be corrected. The three main types of bias that can occur in the forecasting systems are a bias inherent in any perceptual system due, for example, to the imperfection of the organs of prescription or apparatus. Bias that can be considered unfair to certain social groups, and bias that discriminates on the bias of legal grounds. The issue of bias and fairness in machine learning models can be very dangerous in the context of healthcare, as the results of these models can influence important and even life-changing decisions. Systematic errors can lead to incorrect or unfair decisions. This is possible when there is a discrepancy, especially if they discriminate against entire categories of people, such as racial minorities, women, children, and the people with low incomes. Other ethical issue that is particularly relevant for the AI is the opacity of AI models. Currently, there are several standards of regulations for evaluating the safety and efficiency of many AI-based products used in healthcare. For clinicians and healthcare systems that use AI in ways that can influence healthcare decisions, it's critical to understand the limitations of AI methods, data, and models when applied to specific patient populations. One type of ethical concern that we will focus on in this course is the problem of conflict or competing interests. This is a problem that arises especially in the field of healthcare. There are many ethical, legal, and regulatory factors that define the limit and funding the delivery of healthcare in ways that are not applicable to other types of products or services. The general ethical framework applicable to the development and use of artificial intelligence in the context of healthcare are that all professionals adhere to ethical standards and are guided by professional ethics in accordance with the code and guidelines. The term specialists refer to those are entrusted with the well-being of people seeking qualified help when they need it. Doctors are given access to the patient's private health information and are even allowed to perform acts that would otherwise be considered criminal. The social contract with the implicit in the concern of professionals allows such actions if they are necessary to ensure the well-being of patients. A feature of the profession is that doctors are given a lot of leeway to self-regulate. Professionals have fiduciary duties such as obligations assumed by a person who carries out the professional activity for the benefit of another person. Treating physicians must rely on regulatory authorities and manufacturers of drugs and devices to ensure that the diagnostics and treatments they are providing to patients are safe and effective. Existing regulatory system for the evaluation of drugs and devices, as well as certification systems for the evaluation of hospitals and laboratories, are critical to maintaining the trust and both physicians and patients. This becomes very important when you think about how to develop artificial intelligence for health applications, because these systems need to be trusted in order to be successfully implemented. While treating physicians and healthcare organizations will try to serve the best interests of their patients, they have their own interests and are subject to many competing or conflicting interests. The most important in this context of healthcare are financial interests. Understanding the interplay of these interests and how they are shaped by the structure of the healthcare system is critical to understanding how intelligent models may or may not be consistent with these interests and affect patients' care and well-being. So, the large and complex healthcare system exists in the environment of explicit consents regarding to the behavior or support of the patients and healthcare providers. These incentives often serve to improve the effectiveness of healthcare system in general. The existence of incentive structures embedded in healthcare system through payment models means that doctors, hospitals, and insurers need to assess metrics related to the quality of care, costs, and utilization. These stimulus structures have also led to the classification and prediction of patient characteristics and care. Machine learning systems have performed particularly well in classification and prediction, including using really large datasets. And especially in terms of probabilities, AI-powered predictive analytics are favorably applied to health data for classification and prediction. The amount of data collected from a huge number of patients and the electronic information gathered when interacting with these patients gives us the opportunity to turn to the technology of big data. Intelligent technologies do more than just analyzing this big data. They are really needed to improve the accuracy of classification and forecasting. Machine learning models are designed to predict or identify sources of risk. AI can be particularly effective at identifying unexpected or less obvious risks. Of course, it's necessary to understand that small technologies have a certain set of limitations when applied to health data. And these restrictions most often have ethical prerequisites. And examples of applications that use AI-powered predictive analytics will be the insurance companies building an artificial intelligence model that uses insurance payouts, electronic health records data, and consumer data to predict the insured person who is likely to have the highest care costs in coming year. The ethical problem is constructing this model arises because we know that vulnerable populations such as low-income citizens, people with disabilities tend to bear disproportionately higher health care costs. To minimize the likelihood that predictive models discriminate against patients in these vulnerable groups, it's important that the model has an accurate risk adjustment. The data available in healthcare rarely reflects that they really want to measure. This means that our measurements used for forecasting and classification are indirect metrics. The use of proxy measures introduces the possibility of bias or bias-based proxy values and that they are often imperfect. When the possibility of bias is introduced, there is also the possibility of discrimination, which is bias that leads to negative consequences for certain population groups. It's important to be aware that the limitations of models that are created when you have a lack of data, you need to actually explain the outcomes and in this situation we have often to stick with the data that we have for these algorithms. In-depth learning of the clinical characteristics of the patients presented in the datasets and familiarity with the limitations of the available data is essential to avoid ethical errors in model design. So We will always focus on prognosis power of, and for example, prognosis of readmission. A large information technology company sells analytical services to healthcare system to integrate patient health data with insurance benefit data, which help reduce hospitalization level, emergency room visits, and hospital readmissions. This model has developed to predict readmission within 30 days of discharge. This predictive analytics was developed in response to the medical readmission reduction program, which imposes penalties on hospitals if they have excess readmissions within 30 days of adjusting for medical risk. The program was designed to create a financial incentives to reduce mm, uh, the level of patient readmission into hospitals. There is evidence that the imposition of fines actually reduces the likelihood of re-hospitalization. However, there is also evidence that a reduction in hospitalizations can also lead to unintended consequences in the form of poor care, inadequate care, or not care at all. The way information from the predictive model is used in real-world practice also has its own ethical implications. So there is one way to use it to reject patients for being readmitted into hospital, and another way is to treat them better so they will not require this readmission. The healthcare system is developed a model to predict the costs of patients who have joint replacements. This smart app is designed in response to a typical incentive program designed to reward value-based care known as tied payment. The linked payment focuses on reducing treatment costs by paying multiple providers for so-called treatment episodes for certain conditions. Payment is consolidated for all medical services and providers because the group measures aggregated costs. If the patient's care costs exceed the associated payments, the providers split the payment amount. If the costs are lower than the payment, providers divide what's left. The goal of consolidating payments for services included in the episode of care is to create incentives to improve patient outcome in transactions through improving care conditions. The intention is to harmonize provider incentives across a range of healthcare facilities. There are health care facilities that can interact with related payment programs and which are not able to be involved in them. If predictive models don't include the right data and don't adjust the risks appropriately, healthcare will be provided in a not correct form. So some of the healthcare providers will be excluded from this process and it will be incorrect. So summing up the model, we can formulate the main conclusions here. Healthcare systems consequently have incentives to these ethical concerns. These incentives will make it possible to predict risks related to AI solutions, and AI can improve its accuracy. Incentives can have unintended consequences, and we always will need to analyze them to improve our systems. It's important to understand and anticipate the impact of proxy data and health data limitations on model bias. It's important to understand that the results of the models can affect the behavior of those who use these results, and that this can lead to unintended consequences. In other words, it's necessary to understand that the creation of good and ethical models of artificial intelligence require quite complex and detailed knowledge of how medical services are provided and how they are paid for. Thank you, it's all for today.